Hello, I'm Dr. Sri Krishna, interventional cardiologist. Today I'll show how I puncture the radial artery. I have good success with this technique. Hope it helps others also. Extend and stab the patient's right hand as shown. This is very important to give access to the radial artery. I have slowed down the video so that each step can be demonstrated clearly. Take your time palpating the radial artery. Notice if it is sclerotic. You can roll the artery underneath your fingers to feel for it. Once you localize the artery, inject the local anesthetic just medial to the palpated pulse. Initially in the deeper layers, then pull back the syringe and inject the local anesthetic superficially under the skin just above the radial artery. It is important to form a wheal above the puncture site so that the patient is comfortable during further procedure. At this point, if you have inadvertently punctured the radial artery, don't inject the local anesthetic, pull back the needle, change the direction of the needle, go deeper, and then inject the local anesthetic. You can see here a wheal is being formed. This is a very important step. Then take the puncture needle. We usually use a Gelco needle which has an inner stylet and an outer sheath. The stylet acts as the puncture needle. There is another metallic needle by Cooks. This needle does not have an inner stylet. This can be used for sclerotic radial arteries. The advantage is that it minimizes the number of steps. The disadvantage is that if you miss the puncture, there is a possibility of radial artery going into spasm. After injecting the local anesthesia, palpate the radial artery again very gently, feeling the point of maximal impulse. Directly puncture over this site at an angle of 35 to 45 degrees. Slowly insert the needle in till you see flow of blood into the hub of the puncture needle. If you had missed the radial artery, do not panic. Do not pull out the needle. Palpate the radial artery again, noting its position in relation to the direction of the needle. Pull back the needle and reinsert it. Once the hub is filled with blood, push the needle further in to a depth of 3 to 5 mm. Remember the depth of further insertion. At this point, what I do is I preload the hub of the sheath with the guide wire. This makes it easy to insert the guide wire in once I see a pulsatile blood flow. Hold the sheath as shown. To have a control over the pullback, slowly pull back 1 mm at a time. Once you see a pulsatile blood flow, carefully insert the guide wire in. Make sure it's going in smoothly without any resistance. Pre-inserting the guide wire into the sheath hub makes it much easier to push it in when there is pulsatile blood flow. Once the guide wire is in, remove the sheath. Give a small nick with the blade over the skin. The blade edge should be towards the patient, towards the medial side. Give a small nick along the wire, then insert the radial sheath. Check for pressures, then aspirate flush the radial sheath. Then you are good to go with the procedure.